Are you suffering with trigeminal neuralgia? Do you have shooting pain above the eye or below the eye or in the lower third branch in the front of the chin here? Do you feel pain in the teeth, a sharp shooting, stabbing pain that's almost unbearable? If you are, you're probably suffering with something called trigeminal neuralgia. We just had a case enter our office yesterday that I hadn't seen for 8 months, who came in over a year and a couple months ago. In fact, if you look on her feed, you'll see her video testimony. She was suffering with trigeminal neuralgia for many years, came into our office because she found something online in a support group, someone that was suffering, and said that upper cervical chiropractic helped her. And we got her upper neck corrected. And she did beautifully for 9 months until recently. She was doing construction in her house and doing a lot of overhead work, which is really tough on the neck. It got her in trouble again. She came in because her TN was flaring up, and we got her corrected. And prior to leaving the office after a 20-minute rest, it was already calming down. So you might be asking yourself, how is trigeminal neuralgia? How can that be related to the neck? The top two vertebrae in the neck, the atlas and the axis, house a structure called the brain stem. And the brain stem is where the trigeminal nerve nucleus sits. That's a fifth cranial nerve. The nuclei sits there, and then it comes out through this area, and you have 3 branches. So people with trigeminal neuralgia can be affected in different parts of the face. But having a structural misalignment of the floor of the skull, contraction, the cord and the brainstem, causing that nuclei not to work properly. I have another theory in some of these cases that there's a muscle called the temporalis, which starts right here and it anchors in right here into the TM joint. And I think a lot of these cases, that muscle is tight and it's entrapping the nerve, making that nerve hypersensitive and setting off those horrible shock-like sensations that people with TN suffer with. So if you're someone who's been suffering, you're sick and tired of taking the seizure medications that you've been on, the gabapentin, or it stopped working, do yourself a favor, Google upper cervical chiropractor near me. Get into one of these offices. It's not a cure-all for everything, but TN is quite a high hit rate with people that enter in our office. When we get them corrected, they generally speaking do quite well. So hope this video reaches people who are really looking for a natural solution. I always tell patients, you don't have a drug deficiency, you have a function deficiency. Upper cervical is good at getting your body to function better, so it can function the way that it was intended. And in many cases, not only trigeminal neuralgia, but a whole host of chronic pain and chronic health problems can improve or remit following precision correction. So hope you find someone and find relief soon.